A sensitization caravan through the street of Bamenda set the tone for the 2025 World AIDS Day, commemorated at the Northwest Fund for Health Promotion Conference Hall. Stakeholders, health officials, civil societies, and hundreds of youths gathered with one message: unity, resilience, and renewed commitment in the fight against HIV and AIDS. Representing the governor of the Northwest region, Marcellus Jongwa applauded the progress made so far and emphasized the region's target of achieving an HIV-free Northwest region by 2030.
Since the 1980s, the statistics we've been having have been dropping, and that shows that the Northwest region is striving towards an AIDS-free region by 2030, and the government is putting in a lot towards that fight.
The governor's representative highlighted this year's theme: overcoming disruption and transforming the AIDS response, rethink, rebuild, rise, stressing that despite AIDS crisis that have affected healthcare delivery, the region has made remarkable progress. AIDS-related deaths in Cameroon have dropped by 69% since 2004, with new infections at their lowest in decades. Health experts say that while treatment coverage and viral suppression rates are impressive, pediatric HIV and low testing rate remain areas requiring intensified action.
In terms of our 395s, the first 95, it's where the region was not able to achieve its UNAIDS targets, but we were able to achieve the second and the third 95, that is for persons being placed on treatment as well as having viral suppression for the general population. But we still have a gap, in particular in the pediatric population, and I believe it is within this this framework that we are going to intensify efforts for the fight against HIV in the Northwest region, in collaboration with the technical and financial partners and all the civil society organizations and NGOs working in the Northwest region.
Stigma and misinformation still hinder progress, especially among the young people.
In terms of our activities in the communities, of course, there are still high rates of stigmatization in these communities, because for a long time, education around HIV and AIDS has not been happening in these communities, and so it's understood when we see high rates of stigmatization. In fact, in a study that we did in these communities, we found that about 30% of adolescents 15 to 19 still think that HIV is as a result of witchcraft. Paradoxically, in the age group of greater than 19, we found that just about 6% think that it is attributed to witchcraft. So it just goes to strengthen the fact that the younger population need the right information.
The ongoing socio-political crisis continues to pose challenges for community outreach. Health teams often wait for a period of calm before accessing certain areas. Still, progress is being made in districts like Akko and others, with optimism high for eliminating pediatric HIV by 2030. Stakeholders rounded off the event by visiting exhibition stands displaying educational material, condoms, contraceptives, and community-based HIV prevention resources, reinforcing the need for collective action. With progress recorded, but major gaps still to be filled, authorities insist that only a united community-driven approach can put the Northwest region on track to end HIV by 2030.